Beautiful afternoon to you. Many thanks for joining us on the program Healthy Living with yours sincerely, Oloije Uikohari. Health, they say, is wealth. For you to have healthy life, healthy lifestyle, you need to know how your system works. If you're okay in a particular way, and if you need to actually go for a checkup like every 2 weeks in a month, and also know how your body system works and what particular meals or food or drugs you can actually take for yourself. All right, today on Healthy Living, we will be looking at malaria. Yes, everywhere we go to today, one person or the other will tell you, oh, I have been down with malaria. And some others will be like, the medication we're taking is no longer working. What is happening this season? So today with us, we have the person of Dr. Duke Udeku. I hope I got that right. Because while we're discussing, he said, you need to actually understand how to pronounce my name. Okay, so did I get it well now?
You tried. Actually, Udeku.
Udeku.
Crew.
Udekru.
Yeah.
Oh, okay, okay. Thank you so much, Dr. Udekru.
You're welcome.
All right, so he will be giving us insights, letting us know the reason why malaria is prevalent this season. Yes, it's raining season. So want to know, why is everyone going down with malaria? But first off, what is malaria?
Okay. Thank you very much to start with. Malaria itself is a parasitic infection caused by a parasite which we commonly call the Plasmodium. No, there are various, when I say Plasmodium, we're talking about the general name or genus. Then we have various species of this Plasmodium parasite itself. And the commonest we have in the African country, including Nigeria, is a falciparum. And the falciparum itself is the most, dangerous of all the malaria species, of all the Plasmodium species. And so we have the falciparum, we have the vivas. These two are the most dangerous. But though falciparum is the, far more dangerous than the vivas itself. Then the other two include the malaria and the ovale. Now, like I said, it is a very dangerous, disease which we contact through the bite of, mosquito. And in particular, the female Anopheles mosquito. Oh. You understand?
Okay.
The female Anopheles mosquito. Most times when mosquito come around or you hear noise of mosquito, those are the male. Those ones would not transmit you.
Oh. So the ones we get the buzzing sound,
exactly.
It's those not ones, harmful.
Yes, those ones are the male. Okay. But for the female, they will quietly come
and do their work.
Take milk from your blood and they give you, the parasite. And so, when I say it's a dangerous disease, I know you'll be wondering. Yes. You're wondering because we are in a malaria endemic environment. Okay. Yeah, we're in a malaria endemic environment. And to make things worse is that we have the falciparum here in Nigeria, in the African continent itself. And so it is usually more dangerous amongst, if you want to know if malaria is really dangerous, you just invite someone, maybe a relative or thereabout, who's been outside the country. Okay. Just invite them down to this country, and you will therefore know that it's actually very severe. We're getting used, as same as gotten used to it. Yeah. So hence it's not as severe. But for other persons, it could be as severe for children, children as young as 5 years and below. Okay. It's very, very severe for them. And then for pregnant women, malaria is not something we joke with. Even those with HIV/AIDS, you don't want to joke with malaria with them because it's usually very severe with them.
Okay, is malaria to be tagged deadly?
Of course. You tag it deadly disease because you wouldn't want it to, actually when, like I mentioned, some group of persons, the pregnant women, the children under 5, HIV/AIDS, and for travelers from a region where you don't have, the Plasmodium parasite, from those regions, or maybe they have very low incidence.
Yeah.
So by the time they come here, then there's a challenge. And so for those people, if you want to prevent malaria for them, if you don't want them to come down with malaria, the best is to place them on, prevention. Before they come to a malaria endemic region, such as our country, they have to be started on some anti-malaria, as in for prevention of the malaria itself. You start within 2 to 3 weeks before you come to that country. Do you understand?
Yeah.
And the way you ask if it's to be tagged deadly, now there are 2 types of malaria. When one comes out with malaria, there are 2 types. We have the uncomplicated. Do you understand?
Yeah.
And then the severe malaria. So the uncomplicated is what you commonly see. If you come down with malaria,
Yeah,
you
you
buy
take
your
drugs.
Exactly. And then the severe ones, of course, it comes down with other symptoms. Of course, you know the symptoms of malaria. Of course, we all Nigerians.
No, you might just say, of course, we know the symptoms of malaria.
Nigerians.
But not, but yeah, Nigerians like you say. But some persons, they tend to tag malaria with typhoid. And they say, okay, because I know I have malaria, so I should also treat typhoid. So you shouldn't just make that assumption that everyone knows the symptoms. Some persons might not. They might not know the symptoms. So that's where you come to play. And you let us in on when you're having a particular symptom and you say, okay, this is malaria, I need to go to the doctor to get examined and to know if really I have malaria. So we'll have to ask you, what are these symptoms that one can tell, okay, this is something I am feeling, I need to go for a check?
You see, I am so happy when you mentioned typhoid.
Okay.
Very, very happy. Now, before I talk so much about typhoid,
yeah,
I'll first of all tell us the symptoms we expect for a patient who has malaria.
Okay.
The commonest is fever. And of course, it's not only malaria that causes fever. Somebody may come to the hospital just by reason of saying, noticing that he or she has fever. The person concludes that he or she has malaria. All fevers are not malaria. That you came down with fever doesn't mean you have malaria. So there's a pattern of the fever. And so these are some of the questions we ask, just to know the pattern. Fever may be continuous, but for malaria, fever cannot be continuous throughout the day. But when it comes to malaria, when do you expect fever? Mostly at night. And sometimes it comes with chills, the body becomes so cold, you're weak, you understand. And most times it comes with headache as well, loss of appetite, weakness, body pains. Do you understand? And so these are the symptoms we have. And most times as medical personnel, we always want to confirm the diagnosis by doing a test, malaria parasite test. Either through a microscopy or what we call RODT. However, especially when we use the RODT, you don't want to always, because there are times that it may come back negative, that there's no malaria. But at the end, you realize that this person, even if he's manifesting the symptoms, it's clear, you still want to go ahead and treat for malaria. Now, I've seen a lot of patients, being a doctor, people call you all the time, trying to explain that.
This is
and
what's happening to them.
Sure, some will tell you they have malaria.
Already, before getting to know if the person
they will
has
call
or
you,
not.
doctor, what do you have for me for malaria? And I'll be like, you are the one telling me you have malaria. You have to tell me the symptoms so I make a diagnosis. The worst that happens is people tell you that they have malaria and typhoid. Do you understand? And that's the most annoying thing. You know, malaria and typhoid, they are not twin. They are not twin brothers or sisters. They don't come together. There is no reason why they should come together. Do you understand? And so, in short, people will tell you they have typhoid. You begin to ask questions. The other name for typhoid is an enteric fever. It means it affects the gastrointestinal tract. You have typhoid, you don't have change the bowel habit like diarrhea, constipation, and all that. You understand? So, how come you have typhoid? And when my patient comes and they tell me they have typhoid, you know, I ask them some few questions. And I also tell them, if you have typhoid, you'll be rushed to the hospital. You won't walk down to the hospital and you'll be telling me you have typhoid. You won't even tell me because you will be rushed down to the hospital. Do you understand me? And so, the reason why, you know, I think you are wondering why there is a resistance to treatment. You know, the reason why there is resistance to treatment, I don't know if I'm
No, you're on track, because so many persons right now. I had a colleague of mine, was it on Sunday, yes, he actually told me that he was down with malaria for a month. He took like 3 medications,
Okay.
and it could be that it was the last one that actually helped him subside the effect, and he got well. So it's it that medications are not working any longer.
Yeah. There's, when we begin to, because sometimes we will now have these, let's say, symptoms of malaria.
Okay.
Remember when there was COVID?
Yes.
It's, COVID has malaria symptoms. There are many other diseases around that could mimic malaria. So what if you have something else, and then the next thing you didn't consult a doctor? You go to the pharmacy, and then you buy or you procure drugs from the pharmacist. You're just saying that I have malaria, give me malaria drug.
Yes.
Over time, there will be resistance. So body start developing resistance.
Okay, to that particular drug.
Yes, to that drug. Okay. You know, before now, you heard of chloroquine and all that we'll be using then.
Yes.
Now it's out of the market, or let me put it that way. We no longer prescribe that because there is resistance to chloroquine. Before the emergence of what we now call the artemisinin combination therapy, where you have those coartem that you buy. Okay. Coartem is actually artemether lumefantrine. Do you understand? So this is the latest drug we use in treating malaria. However, this drug is beginning to develop resistance, such that people procure them. You actually treat it for malaria, but it's not working. And then sometimes this malaria is maybe poorly treated. For someone who has, let's say, severe malaria, or the parasite load is much in the body, you know, you want to actually, or some person will tell you that the oral drug, the one they swallow, do not work for them.
Except they take IV.
Yes, they take IV or they take IM, which is intramuscular. Okay. They say that's the only thing that works for them. And then they go to most of these, I'll call them quacks, because anybody that is not a doctor and you give him medications and all that, it's a quack, including a pharmacist. Do you understand? Okay.
A pharmacist ought not to
they are not supposed to prescribe medication. They are supposed to dispense.
Take orders from the doctor.
Exactly. What I expect them to do is, maybe the doctor makes some prescription, series of prescription, and there's some form of interaction. At least they should, you know, make some corrections and draw my attention to it. Not for them to
just go ahead.
Yes, I go to pharmacy and I hear patient, you know, make 1 or 2 complaints. Pharmacy start giving them drugs. That's totally wrong. That's because we're in Nigeria. That's the fact. Do you understand? Yeah. And so a lot of patients tell you those oral drugs don't work for them. And then they tell you that, please just treat me with injection. Some of them end up taking injection, right? Yeah. And the truth is, if you're going to take injection for malaria, make up your mind that you're also going to take oral drugs. Okay. The reason is that the injection is just more like a monotherapy. It has only one drug in it. If you're going to take artesunate as an injection, it has only artesunate. Okay. If you're going to take artemether, it has just artemether. Okay. Do you understand? And now, for the oral drug, this drug, one pill has a combination, we call it artemisinin combination therapy. We have the artemether lumefantrine, for instance, which is a common coartem, lonart, and all of that. So it is called artemether lumefantrine. You see that it has 2 drugs, artemether and lumefantrine. And then we have another one, which is artesunate and modiaquine. It has that together. Unlike when you take only artesunate. Because if you take only artesunate, because this is why you give the IV drugs initially, for patients who cannot tolerate the oral drug, right, because they have severe malaria. Yeah. You want to use that to actually
suppress it.
Yes, to suppress it, so that they, until they are able to take orally, you now commence them on the oral drug. Do you understand? So a lot of patients will come, please, I just need the injection, or they go to meet pharmacy. If you meet me, I'll tell you, because they will suggest to me, and they will tell you they've met a doctor who did this to them, it's only injection he gives to them. I'll tell you, no, it doesn't work that way. Do you understand? It doesn't work that way. So with all of this, we will expect, you know, resistance to develop where we abuse these drugs. Okay.
All right. Thank you, Dr. Duke. Some other persons, we go as far as saying that they have taken these drugs and it's not working, of which you have explained, because their system is already getting used to a particular drug. Now, how long can malaria be in one's system and it's harmful to the person's body, the person's system, and dangerous to the health of that person?
Well, I can't really say for how long it should be. Okay, let me give an instance. I'll give a typical instance. I talked about, travelers from malaria non-endemic region to malaria endemic region. And I told you they commence prevention 2 to 3 weeks before they come to malaria endemic environment. And so when they are in the malaria endemic environment, it is expected that they continue to take the drugs. And then by the time they leave, they still need like 4 weeks to continue taking that drug, because the parasite is, let me use this word, developing within the liver. And it's going to release more what we call merozoites into the bloodstream, and you understand? And so in order to prevent that, they still have to keep taking it for 4 weeks. I'm just trying to use it as an example in order to answer your question. You understand? And now, talking about the severity, how long would it take for it to become severe for anybody who has the malaria itself? There are, like I mentioned, some factors. I mentioned the pregnant women. You don't want them to come back with malaria. And so that's why most times when a woman is pregnant, it's what we call IPT, intermittent prophylactic therapy. Prophylactic means prevention or preventive therapy. You give it to them. You don't have to wait for them to come down with malaria. There's a particular drug which we give to them. We call it IPT. So that's what we give to them in order to prevent them from having malaria. And I talked about children under 5. It doesn't really matter for how long it will stay. It can stay for as long as maybe a very short duration before you know it. So it varies from individual to individual. It varies actually. I don't know if you understand me. Yeah. So I think that was it. Okay.
All right. Even in as much as we are in raining season and so many persons are coming down with malaria, what do you think as individuals we can do in our surroundings to make sure we actually curb the excesses that we're seeing in our society today?
Okay, thank you very much. This is the season. It's rainy season. And pool of water everywhere where mosquito breed. It contributes. And the bushy environment, this can contribute. So, unlike dry season where everywhere is dry, you don't see most of these
the muddy water.
Yes, those water where mosquitoes can actually breed. So that's just the difference between this season and the dry season. And then other ways to prevent malaria. There are many ways, because you have to put all of them together. It's not about, okay, I use mosquito net. It's not about, oh, I usually spray my house. You have to put all these measures together. You ensure that your environment is so clean. You don't want to avoid every pool of water around. Like you go to some environment, you see tin of tomatoes, milk and all that. It is even better you turn them upside down instead of allowing them to gather water jelly. You understand? So we have to ensure that our environment is clean. And even the bushes around, those environments should be cleared. So we are trying to reduce the burden of mosquito bites. And then apart from that, of course, you also want to use, insecticide in spraying your home whenever you feel that there's a mosquito. And the mosquito treated net. You can go to a mosquito laden environment. You want to use repellent. Do you understand me? And then, well, basically...
Now, for the treated net, some persons, they actually don't know how to make use of that. They just go to the market or go to wherever they can get it and come straight home to, erect the mosquito net. So for someone watching us right now, what will you say the person should be the first thing that person should do before erecting the mosquito nets?
Wait, did you say they buy it from the market?
Yeah, some persons get it from the market. Some persons get it from pharmaceutical shops and hospitals also.
Because I used to know that health centers or thereabouts.
Yeah, do distribution.
Yeah, do the distribution. Yes. That people are beginning to sell I'm not aware of that.
Okay. But in any case, how can one treat the mosquito nets, the treated mosquito net,
It's
before
already treated.
using?
It's already
Because
treated.
some persons actually say, when you go there, get it and erect it, there's this symptoms you have in your body. It doesn't go well with the system, except you maybe use a dry or you
Yes,
take
sometimes
it
you
out.
want to dry because it is treated with chemical.
Okay, okay.
You know, your skin may not even may even react to that chemical. Maybe when it comes in touch, in contact with it. So this chemical you want to, you can spread this outside for it, for the chemical to at least your hair, so that it doesn't become harmful to you in the bid of trying to, you know,
make use of
fight
it.
against malaria. So you have to spread it at least for some time before you know,
make use of it.
Make use of it.
Okay. All right. Thank you so much, Dr. Duke. The surname again?
Udekru.
Udekru. I will not forget that. Dr. Duke Udekru. Thank you so much for being here with us, educating us on malaria and the reason why we're having resistance this season. You've heard it all from him. You don't have to wait for you to go down with malaria before you go get yourself treated or get tested for it. Now, he said also that malaria and typhoid, they are not twin, right?
Not twin,
Okay, till be seen again next week for another exciting time. Take good care of yourself. It's when you're healthy, you can actually remember that you have a cloth somewhere you can put on, wear makeup, look fine and all of that. So please do take good care of your health. And always remember, there is a doctor out there that is waiting for you to come meet them and give you proper solutions to that health issue. So I'll be seeing you again next week for another exciting time. Do have yourself a blessed day. Bye for now.